The role of nursing in global healthcare compared to current health issues faced by minorities in the United States of America. By group members Misty, Riggio, Emily, Schuenemeyer, Samantha, Seto, Iryna, Shemberko, Galyna, Tsekh, and Aileen, Zapata. Class code NUR4667. Class name Nursing Perspectives and Global Trends. Location at a South Florida hospital. The date of July 28th, 2024.
Topic: Defining the role of nurses in global health and identifying current health disparities faced by minority populations in the USA. Purpose: This project will describe the relationship of nurses in global healthcare and why nurses hold an important role. Current health issues faced by minorities in the United States will also be discussed as a comparison. Background: As nurses, it is important to utilize a global health perspective when providing care for patients as it can improve healthcare delivery to patients. It is important to recognize the role nurses have in global health because understanding the definition can impact the health and well-being of people around the world. Findings: Nurses having a better awareness of health practices and health needs in cultural or ethnic groups around the world allow them to better serve patients, especially in the changing cultural landscape of the United States.
The objectives for this presentation are: 1. Define global health. 2. Examine the role of nursing in the global healthcare environment. 3. Examine current health problems faced by minority populations in the United States. By the end of the presentation, participants will be able to explain the importance of the roles nurses have in global health, examine current health issues that minorities face in the United States, define what roles nurses have in global healthcare.
What is global health? According to Schuenemeyer, global health is defined as problems or issues related to health that go beyond national boundaries, and that is best addressed by cooperative actions. Global health places a more worldwide emphasis, going beyond a nation's borders and focusing on a more broad, multidisciplinary approach to emerging health concerns. The World Health Organization is a prime example of what global health is. They conduct research involving the help of multiple countries in order to enact their global health projects. This has caused the World Health Organization to establish a solid knowledge base with relevant, valuable data that can be directly used to develop global health, such as incorporating global efforts to control HIV/AIDS.
Global health should not be confused with public health. Here is a graph developed by Duke Global Health Institute that differentiates global health from public health. As you can see, the main arguments that differentiate global health from public health are their areas of impact, the amount of global cooperation, program focuses, health equity focuses, and the type of disciplinary approaches. Global health focuses on issues that impact health that go beyond national boundaries, while public health focuses on issues concerning the population of a specific country. When developing solutions, global health often requires the assistance of multiple countries, while public health does not. Global health strives to achieve health equity for all nations, while public health tries to develop health equity within a nation. In global health, they are more multidisciplinary in approach, going beyond health sciences, while public health encourages a multidisciplinary approach focusing only within the health and social sciences.
The role of a global health nurse is similar to nurses of other specialties, but on a larger scale. A global health nurse is expected to be able to assess and evaluate individuals, communities, and populations. A global health nurse also works with legislators and other individuals on interprofessional team in order to implement approaches that advocate for justice and equality for all.
Nurses play an important role in global health as they contribute to preventing disease by stopping or at least controlling the spread of infections in understanding populations. Global nurses also help promote health on a global scale as they help educate individuals in impoverished communities about healthy lifestyle choices and preventative health measures. Nurses also contribute to global health by contributing research to find ways to stop the spread of infectious disease, such as during the COVID-19 pandemic. Also, by contributing to the development and implementation of care models based off how a particular country's health system operates, nurses can help make a more positive impact on patient lives as they are able to recognize and take into account the social determinants of health on a population.
So, why should we care about global nursing? Currently, with the increasing threats to health combined with the severe global nursing shortage, many underserved countries in the world cannot afford to lose more of their nursing workforce, as many have been recruited to work for high-income earning countries. An example of this scenario happening is the outmigration of Filipino nurses to the United States. The mass exodus of nurses from Philippines has led to severe consequences on the country's healthcare system, such as a reduction of services, longer waiting times for essential procedures, and increased level of stress, anxiety, and depression on their country's healthcare workforce.
Now we will focus on discussing issues that currently affect minority populations in the United States. Here is a detailed graph displaying the number of minorities that are currently living in the U.S. These numbers were taken from the Census Bureau from 2020. As you can see, the Hispanic Latino population make up the highest percentage of minorities in the USA, while the American Indian Alaskan Native population make up the lowest percentage of minorities in the U.S. Based on this U.S. Census, the breakdown of minorities are Hispanic or Latino, nearly 60 million, African American, nearly 30 million, Native American, Alaskan American, 4.6 million, Asian, 24 million, Hawaiian Pacific Islander, 1.3 million, and other nearly 100,000.
Despite substantial improvements in health made in the last century, many Black women in the United States still face health disparities. This is due to a reflection of inequalities they experience in their social and economic lives. Black women face higher rates of maternal mortality due to their inability to access quality health care services and treatments. Black women are also more disproportionately burdened by chronic conditions such as obesity, as it is more socially acceptable in the community to have a positive body self-image at a higher weight level. This unfortunately leads to the development of cardiovascular diseases and increase their risk of stroke. Another example of health disparities faced by African Americans in the past that also put into question the ethical approaches to medical research was the Tuskegee study of 1932. Hundreds of African men who took part in the study thought that they were being treated for syphilis or other bad blood ailments. However, the participants were not being treated at all, and instead the researchers were simply documenting the natural history of syphilis. Even when penicillin was developed as a treatment of choice for syphilis, African American participants were not offered the medication. This event marked a huge reflection of the unequal treatment African Americans face in the United States history due to their perceived low social status.
Global health plays a pivotal role in nursing. As registered nurses, we are expected to maintain cultural competency in order to provide the best care to patients of all backgrounds. The topics of this project are significant because it highlights the importance of the nursing role in global health. As a nurse, are able to address health issues in a variety of settings. By understanding that nurses impact care delivery, education, leadership, and policy making in the context of global health, governmental healthcare institutions may implement interventions that specifically influence their country's population health outcomes. In conclusion, understanding global health and role nurses play can positively affect disadvantaged communities as they understand the significance of providing culturally competent care.
And in conclusion, here is a slide of all of our references. Thank you for listening to our presentation.